And each of these three categories of family members, peers, and mental health professionals are subdivided in a lot of different points of view. So I don't want you to think it's as simple as these three communities, because there's different kinds of each. But broadly speaking, we've got family members who are people who care for someone with a mental illness or supporting. So you could also call that family members and supporters. And that's one group of people that we can target and reach out to and communicate with these trainings. We have peers, which are people with lived experience of mental illness. Other terms that people might use for peers might be consumers. Some people say survivors or users of treatment. Earlier, I said people with psychiatric histories. That's all terms to identify the same thing, which is someone who has lived experience of mental illness. And that's one group of community. And then the third is mental health professionals. And there's many different kinds of mental health professionals. But these are three broad types of communities. And we had to decide when we were going to offer trainings to mental health communities who to target. We think it's valuable to reach all these stakeholders and teach all of them mediation and communication skills. But ultimately, we decided to start with the peers. And we did that because we're hoping to empower those peers to have their own voice and to teach them skills so that way they can ultimately diversify the mediator pool by becoming actual mediators within the community, within community mediation in Baltimore and other cities. We think it would be great to get mental health professionals to start learning more about mediation and to do so in a neutral manner. There are already a lot of mental health professionals who do mediation. I'm guessing probably some of the people in the webinar right now are mental health professionals of some kind. Maybe they're a mental health counselor or a social worker or a psychologist. I would be surprised if there was a psychiatrist who's doing mediation, but if you are, please say something because I'd love to meet you. But I have met all these other mental health professionals